Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us, and today's webinar is on application and plan comparison tips and tricks. My name is Ayesed Odiale, and I'm the Health Projects Assistant at the Center on Budget and Policy Priorities. I'll be moderating today's webinar. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces, and Medicaid. CBPP is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and we are not able to offer continuing education credit for our webinars at this time. Webinar logistics. Automated captions have been enabled for this webinar. To view them, you can click on the CC icon at the bottom of your screen. If you do not see the icon, you may need to click the More option with 3 dots first to see the closed caption option. All participants are muted and in listen-only mode. If you would like to ask a question, please click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A at the end of the session. We may not be able to answer every question asked today, but we will have a record of all of your questions and will use them as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. A quick reminder that you will not be able to click on any of the links shared in the deck, but I will put these slides in the chat where everyone can find active links to everything being shared today. And after today's webinar, we'll send an email recording out of the presentation along with all links to the slides and other resources. And we'll post everything to the Beyond the Basics website. So to get us into the agenda, today we will cover pre-appointment, application, plan comparison in 2 parts, a deeper dive into standardized plans and summary of benefits, and lastly, post-appointment. Today's presenter is Arianna Anaya, who previously served as a certified application counselor, community health worker, and navigator in Texas and Illinois between 2014 and 2022. Also joining us is Farah Arzuki, Senior Policy Analyst at CBPP. She'll be monitoring the Q&A chat. So with that being said, to get us started, I will turn it over to Arianna.
All right. Thank you so much, Ayesat, and everyone else who is here. It's always such an honor to do anything for Center on Budget and Beyond the Basics, but it's of course especially an honor to get to take some time to talk with people doing this so important and sometimes, let's face it, very challenging work. And I myself found as an assister, year round, for whatever reason, is sometimes a lot more challenging, I think, than open enrollment because the task changes to some extent and the options might look a little different. So part of today will be reinforcing some habits that I myself kind of always forget when I'm in the year-round enrollment world, where I figure out, do they have an SEP? And then I'm kind of gunning to go, when still, those regular things that need to get done during open enrollment do still need to get done, do still need to be kind of checked and made certain of during, the year-round world. So we're going to touch on some things that, may seem obvious, but I think the point is just ensuring you guys all have all the collective tools and thoughts and ideas of some of our experts and some of our expertise. And there will be some time for questions, of course, at the end. And I will also share my contact information if there's any question you would like me to take a look at individually. I'm always happy to do that. And of course, Beyond the Basics is such a wonderful resource for anything and everything. So without further ado, we're gonna move ahead into talking about a sort of pre-appointment situation. So I like to reiterate these points. Some of these were suggested by our lovely coalition of leadership who diligently keeps Center on Budget Beyond the Basics informed of what assisters are seeing kind of on the ground in the day to day, but who also for this webinar contributed just some really wonderful, well worded reminders, right? What are the things that we want to kind of emphasize and reiterate as we we navigate this year-round world, and then also, of course, as we get closer and closer to open enrollment. So again, it's you still will need an email address, right? Making sure the client knows ahead of their appointment that if they do not have an account, they need an email address they can access, which for some of our more vulnerable users might be a situation where you end up making an email for them, right? But for others, making sure that that's something they understand is necessary for this process. It doesn't have to be a barrier when people feel prepared. When they don't, it can be an overwhelming thing to have to create an email just for this process. So the advisement we have is to potentially build in a little more time to a year-round appointment if you know that client's going to need help setting up an email address, because that in and of itself can be a bit time consuming. Another good pre-screening question, if you talk to clients ahead of their appointments or if they do something online to set an appointment, is to give them access to that employer coverage tool. So it's something they can, in theory, have an employer or HR fill out for them ahead of time. Because that work, of course, as we all know, can eat up the entirety of an appointment, especially if it's at a time of day where HR or, the specific job boss is not available, right? Having them done that work, like with the email ahead of time, will save you some time and possibly some agitation for the client. Um, the recommendation is as much as people can be screened ahead of time, the better. And I think why this is important is to some extent, everyone who's eligible is eligible during open enrollment. But the trick here is tricky because you have this SEP situation. So ensuring to some extent that people understand there's no guarantee that you're walking out of here signed up for health insurance, right? Because sometimes the logistics of the SEP might potentially mean they can't sign up yet or they can't sign up at all, right? So it may again save the client and yourself a difficult conversation if you're able to figure out that piece of eligibility by phone. Now, I would say we never want to dissuade anyone for coming to an appointment if they want to come, right? But making sure clients understand this is an appointment to screen you for eligibility to sign up rather than this is an appointment to sign you up for health insurance. Being able to hit that note really, to my mind, can set you up for more success in these year-round appointments. We are also listing the FPL chart just to make sure people have that handy. I've always used my organization one, but the one Center on Budget makes is just beautiful. So always being able to kind of pull on that because of affordability being such a factor for so many of the clients we serve. Um, I think very important, right? So often individuals who are going through change or tumultuous circumstances may not know where to turn or where to go for any given thing. I've always been struck by how often someone who's recently lost their job doesn't understand that a food pantry might be a really important way for them to, substantiate limited income and limited funds for themselves. You can get groceries, right? Like you can have that expense off the table, but so often someone who's worked their whole life and lost their job is like, that's not for me. Like, that's exactly who it's for, right? Community health centers. Sometimes you'll be working with someone whose family member perhaps is not eligible, and they may not know about the existence of federally qualified health centers or any sort of community clinic where they can go and pay a sliding fee scale. So having these tools in your back pocket really can be helpful and really can contribute to this overall endeavor when it comes to, ensuring our community is well and ensuring our community is whole. So there's some listed ideas when it comes to services in your area, that it's not a bad thing to familiar yourself with and to make mention of, especially, outside of the chaos of open enrollment. We have some also, if possible, having an additional screen is always a wonderful idea. I want to be honest about the fact that that's probably not an option for most of us. When I read that, I was like, yeah, that would be great. But usually resources are so stretched that, having more than one computer set up for a given assister and a given client may not be necessarily doable. But sometimes after open enrollment, you have more screens than you have year round staff. So it can be something to put into action so the client can look at it with you. But beyond that, making sure the client is engaged as you go through the process, right? Always a good idea to kind of ensure the accuracy of what you're entering. They can kind of fact check a lot of it for you. And it's just a good practice as you go through, generally speaking. So after those, we're going to move into talking a little bit, certain highlights, certain specific items when it comes to the application. My focus generally as an assister has always been on HealthCare.gov because I've lived in states that used it. But I actually now live in Vermont, which has a state-based exchange. And I've done a lot of work looking into different state-based exchanges. And the reality is they do hold much in common. There's always little tweaks in terms of where things are, how to do things. But at least the language tends to be pretty consistent across the board. So though I am using healthcare.gov screenshots and also referencing that website for the most part, just bear in mind that this should all be applicable to any state-based exchange. Okay, so just to kind of give an overview of certain elements that we want to ensure everyone is on more or less the same page about, some delicate situations include first and foremost individuals who are survivors of domestic violence or spousal abandonment. Um, in theory, first and foremost, are actually eligible for an SEP year round. It's a little trickier than that. Be aware of that. And it's a tricky topic to bring up. But often you've had this discussion ahead of getting into the actual application. But what that will mean is when it comes to kind of setting up the tax household, you want to indicate that person as single. This is confusing because when they file taxes, they will often still file as married. And there's kind of another process the tax filer will go through. But for purposes of the exchange, not just the marketplace, but also state based exchanges, that person is going to effectively be single for IRS purposes when it comes to the marketplace application. So keep that in mind. They're essentially eligible for a kind of exemption despite being married. So, for our purposes, and to ensure you generate the correct result, you need to indicate them as single, not married. Though, when they see you do this, they'll be like, whoa, 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 I am married. And you can hopefully give them that quick explanation that the IRS, for our purposes, when it comes to the marketplace, will consider them single and that their tax preparer, they need to make sure they're being clear about this circumstance then as well, can assist them in ensuring that that's done properly. Another kind of tricky element is, you get kind of used to asking questions, I think, and entering the responses of clients as you go through the application is a pregnant enrollee. All questions regarding pregnancy should be indicated as optional. And the reason is if you indicate the person is pregnant and they are eligible for CHIP or Medicaid connected to that status, the application will automatically route them there. That's not necessarily bad, but the person has the option not to go to CHIP Medicaid connected to pregnancy. If that is the case, and it's a good thing to make sure you've discussed, make sure not to indicate that they are pregnant. They have every right to stick with their marketplace coverage if they already have it. They're not required to go to CHIP Medicaid as a result of being pregnant. That's one of these strange exceptions to those entitlement programs where pregnancy does enable you to kind of, to some extent, pick. And so be aware because you don't want someone kind of kicked off their coverage who in actuality has the ability to stay with their private plan versus state-based CHIP or Medicaid for pregnancy. So keep that in mind. Something too that I think becomes a little bit stressful for families with mixed status is that though you might be doing an application for someone who's perfectly eligible, other members of the household may not have an eligible immigration status for the marketplace. That's completely fine. It comes down to the distinction of who's in the household, the tax household, versus who's applying for coverage. So be clear about that because it does, I think, sometimes reasonably, understandably, it gives one pause to see their family member listed if they're not applying. And the deal here is you should not be entering immigration information for any person who's not applying. Yes, they're part of the household and should be listed as such, but their immigration information is not relevant and should not be included because they're not eligible and they're not applying. Finally, something I think I saw a lot in towards the end of my tenure in Texas, working as an assister, were situations where I had a lot of volunteer assisters who were of kind of an older generation. And sometimes they didn't know necessarily how to ask questions connected to one's gender identity, which the application, does ask questions about, right? So I think the advisement we got from one of our amazing partners is to just be very direct, sensitive, of course, but direct. And what I have sometimes done as a manager when I see that this is a logistical confusion for an assister, it's not a judgmental thing. It's they literally are not sure which pronouns to use with a certain client, is to sort of drop by and say, "Hi, I'm Ariana. I'm the manager here. My pronouns are she and her," and let the individual answer, respond with their intro to an extent to ensure there's comfort within that interaction. And it really made a difference, I saw, when you can just, be straightforward and, make this part of the conversation as opposed to something awkward that people don't know how to address well. Like, just be direct, but be sensitive. Okay, so as we proceed, further and further, it's funny to think about how young the ACA is as a piece of legislation. And yet, it's kind of hitting its middle, not as cute toddler years, like it's not a baby anymore. The one thing we want to ensure is happening and happening correctly is that CISIO and CMS and every entity that provides oversight and data on the work of assisters understand that it's very unusual that enrollment is a one-stop process for assisters. We want to ensure that every assister who touches an application gets the credit they're supposed to. And so where this is concerned, when it comes to the actual HealthCare.gov, I know that obviously navigators have all this data that they wind up doing. CACs don't have to report as much federally. Doesn't really matter. Let's not get into that. But this screen, both within healthcare.gov and also with the exchanges, is where one would indicate that they are helping a consumer. And it's where they kind of get credit for that step. So it's very, very important to ensure this is filled out. Kind of the essentials, the pieces you always want to ensure are completely filled out are going to be your first and last name, and ideally your ID number. And this should be the number that is created connected to your completion of the CMS training or depending your state-based training. But your entity, your sister entity, usually will be the one to assign it to you. But again, make sure you know that number. It's usually the thing on your big certificate that's way too long. It is, you want to include the whole thing. You want to indicate your role appropriately, and you want to make sure your first and last name are there. Ideally, your organization name is there as well, but from what I've understood, that as long as that CAC or navigator number or whatever other number it is there, you're in good shape. So those are like the three essentials as much as possible. What I think is more confusing and in the year-round realm, let's say one of you are assisting this client after the fact, after I had already worked with them as an assister. And this, I think people always feel a little squicked out by because nobody wants to erase another assister's work, right? Wrong. You must. You must update. You gotta remove that former information and include your own. Because as we all know, every application generates a new application ID. that former assister's information is connected to that earlier ID. So it's almost as though here is where you get that credit. Here's where your entity and all assisters get the credit for that second touch. And this is something that advocates really want to make sure people understand, people at the CMS societal level, that it takes a kind of village, and assister assistance is so essential. So you may feel weird about it. You're not damaging anything. The information from that previous assister has been submitted when they submitted that application, and you want to make sure yours is, with any update actually done to the application. Oh, and that's a reminder of where to put those things. And again, not a bad idea to include your organization's name, but I know that sometimes we're working fast, and what I've heard is those three things are the essential things. Include the organization name when you can, obviously. All right. So I wanted to start once we're in the application. So let's actually pretend at this point that we're not in the application, that we have a client, maybe a walk in, maybe an appointment, somebody that your entity served before. And let's say you didn't work with that person, and that person's name is Beatrice. She's back because she's incredibly responsible, and she remembers, she remembers that at some point during open enrollment, she was told if your income changes, you want to make sure to update it. And she did a wonderful job coming back and not calling, just because sometimes when you call HealthCare.gov, bless them, they will just update it without really talking through it, and sometimes that can cause big, big challenging issues for a client who's, making a change that applies to 1 month rather than the whole year. And that's something to always keep in mind, is that reconciliation, which is when you have to repay or when you receive money back connected to the amount of tax credits you were getting, is always based on the total amount received. It's not based on the monthly amount. And that, I think, can be confusing because most people consider their income month to month. And so when they see it dip or see it increase, sometimes they're galvanized to go and moderate it back on that month. Sometimes it's the right thing to do. Sometimes you actually had a big month and next month is slow, right? This is a conversation to have for sure before like just doing it. So we're going to say that she had originally estimated at $36,000, and she has this rather elegant way of doing that estimate, which is 10 homes a week, 70 per cleaning. What she's discovered a couple months in is that, and this is a scenario we've actually seen, with the economy and inflation being what it is, people are perhaps getting rid of certain needs, certain services, and unfortunately, house cleaning is one. So she's doing about half of what she's doing, which puts her income closer to 18,000 versus 36. So there's kind of a hypothetical situation we want to think about here, which is, what do you do with this client, right? What if the reverse were true? What are some considerations, right? So to my mind, when I'm the assister, I need to be very, very cautious and thoughtful the fact about just making this update, even though it's like the good update to my mind, right? Her income's lower, it means more assistance. I need to make sure that it's not going to put her down into Medicaid without ensuring that she understands that. Or she might live in a state without Medicaid expansion. And then if she's under 100% FPL, it's going to stick her in a situation where she has to pay full price for this plan, which is about, what is it, $1,100 a month? Right now she's paying 700, which is quite a bit if you're only earning 18,000 or so a year. So it's clear this is probably unaffordable generally, but you want to be especially careful. How big is her household? Does she have any kids? Like 18 still works to be eligible as a single person. But if she has two or three kids, or if she's married and she's the breadwinner, this could kick her out of PTC eligibility, right? Some states that means Medicaid, some states it doesn't. So don't open the application to check the income calculation, is my first advisement. Have a conversation in terms of, has anything else changed? Did your husband, oh, I see that. So you're married, you have three kids. Is your husband working now? Are all the kids like, what's going on? Feel it out before you jump right in and start making updates, because often there's more than one update that you need to make, and that can be problematic. if you update the income and then she says, "Oh, I also had a baby," and you go back through and do that, certain second changes could wipe out that SEP, meaning you won't be able to enroll her anymore if you make a change that doesn't again generate a special enrollment period the way an income shift of this type would. So, again, this is my 2024 FPL chart. It's the one that I made as part of my entity in Texas that we use, and I like it because of the way it breaks down the 150, the 200. This works well usually when we think about what the reconciliation caps are for cost sharing, but of course also for PTC. So it tells you kind of cleanly or clearly a person's income goes over this amount. Okay, that ups how much they're potentially repaying come tax time. So always recommend when the client comes in, we start with let's recalculate the income. Let's start from scratch almost. Let's not necessarily even worry about the original income estimate, but let's talk it out with the client and see what the new income is. And then we can compare it using this chart or whatever FPL chart you use to what was earned and discuss the implications of it ahead of making them because the consumer doesn't necessarily know, oh, everything's going to change, right? Sometimes it's a good change, but sometimes it's going to be a change that requires more from them financially. So use this to help them understand what's going to happen. You can also, of course, use the preview tool on healthcare.gov. I want to say it's called See Plans and Prices. So rather than having to rely on the application to give you that information, use a tool to get a sense of what that means for the person's eligibility so they know what's coming. So it's not a horrible surprise, right? Um, Make sure as well, in certain situations, people come back, they do that income update, and they're like, well, if I can change plans anyway, I had this problem, that problem, I want a new plan. Make sure they understand if they have already contributed to their deductible and out of pocket max, if they've used the plan, usually for anything more than like copays, that money is not going to transfer necessarily. If they're changing companies, for sure it's not going to transfer. There are some companies that allow a client within their same company to transfer, but it usually has to be pretty unique. Usually it's not going to work across metal levels. So if I change from silver to bronze, generally that's not going to carry. And it's only a couple of companies that I know of. So generally speaking, it's a new plan if you change your plan. Keep in mind as well, usually clients think changing the plan will solve a problem with network issues. Often it won't, right? Often they're trying to fit a square peg through a round hole where they might be attempting to get someone into their network of providers who actually doesn't accept marketplace plans at all. I see that a lot up in Vermont. We have two companies and it's kind of like people accept them or they don't. And so checking that, right? Sometimes I have a client, oh, I want acupuncture. Yeah, it doesn't, there's no plan in Texas that will cover acupuncture, right? Like fact check that inclination from the client before you're like, yeah, great, let's switch you because probably that'll work out. Often the client needs a little re education about what's possible within insurance. And year round is a great time to help them understand that. And doing so helps us be better assisters. It helps us learn more and more about the companies and about the plans. So, one thing I also wanted to point out here is so in this situation, Beatrice has not a bad situation. Let's assume she's a single household. Let's assume she stays eligible. This was her original plan. She's what she chose for whatever reason, kind of the pricier option within her market, which I want to say is Miami. I don't remember, to be honest, somewhere. But the PPO is an option, and she picked the Blue Cross Blue Shield PPO, which can have certain benefits when it comes to the network. It's a very broad network. If we do update her income based on what she had described, she will start paying less, but it's still a lot, right? And when we think about the fact that this woman is going to be earning a lot, she might want to make the decision to switch plans. There are much less expensive plans available, but you would want to be very clear with her that there was probably a reason originally why she signed up for this plan, right? The PPO. So just jumping down, for example, to this plan, which I want to say is the least expensive plan in that network. Yeah, clearly this is much more affordable, but she might be losing access to certain providers. Again, if she had contributed mass amounts to her deductible, it doesn't make much of a difference here because her deductible with the new plan drops to zero, connected to additional cost sharing with her new income. But her out of pocket is something she would have to, in theory, meet again, right? So those are not insubstantial considerations. If this is someone who had major health issues and that's why they had selected that PPO, this ambit or EPO might not have the same people in network. So be clear that just because there's a less expensive plan that they're now eligible to enroll in with the SCP, it doesn't mean it's equivalent coverage. So her ultimate decision might be to swap to this less expensive plan. Obviously, having insurance would be more important than not having it. And I have a hard time imagining she can afford to pay $600 a month given her financial situation. But who knows? She might be receiving assistance for that through some entity or through some program. Who knows? So just make sure you give them all the facts. Updating, I think, is even more complicated in certain regards than that initial enrollment because it can really cement something into being final that the client doesn't fully understand before it's explained. So make sure you've hit all those notes as best you can. Uh-oh. What have I done? And here, just to make sure we're on the same page about it, is the chart that again, this is my former entity, but Beyond the Basics also has a host of these pieces of information. The chart on the right iterates that what the caps are when it comes to somebody's financial liability for overpayment of PTC. So let's say I estimated my income at 15,000, right, which is between 100 but under 200, yeah. Let's say my income winds up being, I don't know, let's say 23. The max I would have to repay for the year is 350, right? Because I'm still between 100 to 200 FPL. Again, if conversely, let's say I'd estimated at, I don't know, 200 and I wind up above 250, then it changes, right? Then I have to move down to potentially looking at this 300% of the FPL level. So it also depends if Beatrice was married or had children, I would have to look at the other column. So this can be a useful tool too when it comes to ensuring that clients understand at the end of the year they could get money back, but they also could have to pay out some money. Also important sometimes for them to realize that these caps are very, very generous. Just looking back at what Beatrice would wind up saving in terms of cost sharing versus the liability for PTC, right? This is set up to ensure that the consumer is not unreasonably penalized if their estimate isn't right, as long as they don't go over 400. Okay. 400, then you're potentially having to pay it back up to a sort of certain percentage point. You don't get these nice flat caps, but these are useful for reminding clients about that liability. All right. So in theory, having talked about the application and some of its quirks, we're going to talk a little bit about two places when it comes to plan comparison. So these were two spaces that Beyond the Basics asked me to build resources for over the summer. And frankly, it was kind of a chaotic summer. We had a big flood up here, and they wound up being done quite a bit later than I had intended. So unfortunately, I don't think they got the usage that we had hoped. And we noted that there was still a little bit of confusion when it comes to these items, and it is because they are confusing, especially the standardized plans, which are called easy pricing plans on HealthCare.gov. Um, Summary of benefits, I just find fundamentally always confusing. I think it's one of these like tools where once you understand how to use it, it makes sense, but it takes a long time. It takes like seeing so many. So we had designed a bit of a resource, hopefully, for our sisters to expedite that. So just generally speaking, and again, this comes from our incredible team of experts who are out doing this. Using insurance terms to describe keywords really is such a helpful thing, but being mindful of the fact that sometimes they're not right. Like I see so often the definition of deductible being you must pay this before your plan pays anything. That's not right, right? What about copays? What about, it's that's simply not complex enough of a definition. And if you open with that, as many people do, because deductible is one of the first items that crops up when it comes to plan selection, you will scare the bejesus out of many a client because the deductible is often quite large, right? Many people go their whole year without touching their deductible while using their plan. They're getting scripts, they're seeing doctors, but that really is going to come into play depending. So ensuring that you help people understand that yes, the deductible is something you may have to meet. Often a person doesn't. And if they do, they're usually saving lots of money because of the fact that those services are much more expensive otherwise. People often don't understand that even if they're paying quote unquote full price for a service because they have not yet met their deductible, they're actually not paying full price. They're paying kind of the negotiated rate as someone who is insured. The full price, if you're uninsured for, let's say, a scan or blood work, is actually quite a bit less the full price, right? That you're paying as an insured person than you would be if you are not. Um, Always a good recommendation to help people pay attention to what the case scenario is, because that's actually a number we can give them. It's impossible to tell them an MRI on this plan will cost you X dollars because there's just no answer to that. There are too many other factors that need to be considered. But the worst case scenario, we can give them. And I personally, as someone who's acquired massive, massive amounts of medical bills, I find that number very, very inspiring. It also can help you educate someone who's like, oh my God, that's a huge number, where you're like, unfortunately, it's not. Unfortunately, 10, 12, whatever $1,000 relative to what a uninsured medical procedure can wind up costing is not actually that expensive that it protects you. Finally, too, some of the tools that can be so helpful, the window shopping tool, which I referred to as the C plans and programs tool, and even calculating the financial assistance they're eligible for ahead of time can be so helpful for you to play with year round, but also to show, if time allows, if somebody shows up and you're not going to do a full application that day, but you have time to go through some of the logistics to teach them a little, to make them feel confident about coming back. These are great ways to do that without actually dealing with an application when the person is not ready or doesn't have the information necessary to go that route. And again, too, I think if it's possible, like if there are doctors they don't know the names of, I'm always amazed how often that happens, but it does happen. Um, Making sure they kind of understand as much as they can ahead of them getting that information, right? Giving them the tools to ask their doctor, not do you take Blue Cross Blue Shield, but rather do you take the Blue Cross Blue Shield offered on the exchange, this plan type, this name, etc. Like making sure they know how to ask those questions. Um, Again, too, I think just ensuring that that plan education stuff doesn't go away. People often need it more during year round because it's less available. Reiterating it, right? Sometimes when I do an update for a client, when I get to the end, even if they're not comparing plans, I'm like, have you gone to the doctor this year? Have you had your wellness woman exam? Like, how's it gone? And sometimes I learn the client didn't know how to do any of this stuff, and they've just been expecting the insurance to serve as their emergency, right? Their liability car insurance, basically. And they didn't even remember that they could pay $10 and see a PCP. So, just helping people remember this is such a good thing because we forget, right? We're busy. Life is complicated and distracting. So I wanted to provide some of the responses that we saw from Socio that came from different assister entities. And I want to say that most of these were coming from individuals who would poll the assisters at their sites. So someone in a managerial or director position was kind of summarizing a general response from a lot of their assisters. And yellow is highlighting what I think are very common and very sort of accurate complaints to some extent. connected to what a standardized plan is and what it can do for consumers, but more importantly, what it actually does for assisters. How these easy pricing plans, as they're called, are actually a tool in your back pocket to make these conversations a little easier, and they're so hard. And helping clients understand how the marketplace functions and how plans function within. So here's sort of an overview of that. And of course, as ISAT mentioned, we are sending these out. You can look at that more deeply. Um, but I did want to talk really quickly and just kind of utilize math, for lack of a better word, to show how these easy pricing plans, also called standardized plans, actually relax the burden a little bit on assisters in terms of the sheer number of plans they're kind of responsible for. So we're going to go to Franklin County, Ohio. I forget what zip code, unfortunately, to look this up, but for 2024, there was a total of 113 plans, 8 total companies. And the nice thing about the tool, the filter tool, is you can pull it open and you can get this detail yourself if you wish about your own market. So for this specific area, there's 3 catastrophic. Of course, you won't see those for clients who are over 30 and eligible for PTC. So keep that in mind. That 3 is sort of, that's just part of the total, but not everyone is eligible for the catastrophic plans, frankly. 34 bronze, 46 silver, and 30 gold. That's a ton of plans. We can also see all the companies, but also how many plans are listed within each company, which I always find kind of eye opening when it comes to when a client zeroes in on what company they want, which is usually a decision based on network, right? Often cost as well. But you sort of know what the hurdle is going to be depending on which one they pick. Obviously, Ambetter offers a ton of plans, but even understanding that Ambetter actually offers a bunch that are sort of buy-ups with Vision Dental. So, in fact, they're versions of an earlier plan that you've probably explained or that is an option for clients. So it's the same, but plus dental vision. I'll talk more about that later. So that number 24, I find, a little intimidating until I remember that there are these weird buy-up options where it's the plan duplicated to some extent, except with added vision or added dental or both. So if we are in the filter tool, the screen I just pulled, and we click the plans that I want to look at all of them, which why would I do that? I think that's how I was counting. You can see that by clicking bronze, silver, and gold, it pulls open the additional easy pricing. That's what standardized plans mean. I wish they would use standardized plans somewhere in it. And you even get that little helpful price tag in green. Easy plans have the same out of pocket costs and care before deductibles for some services. That is a really gentle way of saying these plans are the same plans when it comes to their cost sharing structure. They're regulated. So, those 9 plans listed under the bronze easy pricing category, those 10 listed under silver, those 10, each of those within their meta level, each company is required to have one that is identical to the same to every other company. So every other company, all those companies I just talked about in silver must offer a standard plan, which is kind of amazing. So essentially, my logic, you start with 34 bronze plans, which is just like, oh my God, the poor sister who has to explain 34 bronze plans. But then you get to kind of technically subtract 9, right? Because you have 9 from these companies that are the same. So to some extent, you're kind of only having to worry about the 25. These are the non standard in which the companies design the cost sharing kind of on their own, right? Versus the 9 are all the same. So what this has done, it used to be that you were picking from, however many companies that were all designing their plans however they wished. Now that all plans have to design one plan exactly the same, it even improves our ability to kind of do an apples to apple comparison of different companies. And then from there, you can pivot to the non standard plan once the person has kind of figured out the company. So you start with standard, which has always been my mode of offering a plan explanation. And then from there, talk about companies. And then from there, can kind of narrow a company. And then if that company has tons and tons more plans, you can move into explaining those plans. It works mathematically and time wise much better. Like it's quite a bit better, right? Because in theory, you're never going to be dealing with a market with 113 total plans again. And honestly, you're not even going to be dealing with 81 if you're working in the order of let's start with the least expensive silver standardized plan because we can compare it to all the companies. Okay. Starting with the least expensive company, this same plan exists for all of the other companies. And then they're like, oh, great. You have a conversation about network. Where can they go with these different companies? And if they're like, well, ideally, that company sounds the best, let's take a look at other plans. You're now looking at those plans within a company. Now, obviously, these conversations can go totally haywire because clients are really absorbing and making a lot of decisions. But I think this, hopefully, this guidance can really save y'all some time and really give us assisters a mastery over the network because you'll just know this stuff. This information is available when it comes to standardized plans. So, again, kind of advocating for this, start with a standardized, I always say a silver plan in many of my earlier trainings. You start with the least expensive silver standardized plans. In so doing, you've explained at least one plan for every other company and now can logically talk about companies, right? And then you can kind of pivot. When you're looking at a silver plan, if the silver plan is too expensive, you know immediately you got to go down to bronze. If the person is looking at silver plans and being like, well, I'd like a lower deductible, you go to gold plans. That doesn't apply to very many people because we tend to serve people eligible for low cost sharing, well, low deductible out of pocket max in silver, but it becomes clearer when it happens, right? Okay. So I'm pulling again. I think I'm still in Ohio here. um this situation that can be a little, so firstly, here's our standardized plan. This is going to change for 2024 2025. This is 2024. I looked for the 2025 metrics and didn't see them yet, but they'll be there. So essentially, this is for an individual at an income that makes them eligible for cost sharing reductions of 87%. So this person, every single company at the silver level is required to offer a plan like this. Like how rad is that? Let's say another company they have is Ambetter. Ambetter has a plan with a deductible of 700, 3,000 out of pocket, and identical copays as you see there. They're required to. It's amazing. And then you can skip to United Health or whoever else. They all, if they have that easy pricing label, you are looking at the same plan as the other silver plans. Ditto with gold and bronze, right? So keep in mind this doesn't cross the boundaries of the metal levels, of course. It can't. But that pricing plan probably means if you've already explained an easy pricing plan, you've explained this plan. This is just the easy pricing plan with Oscar versus Ambetter versus whatever. So these are kind of the metrics for this plan and for all other silver standardized easy pricing plans available in this market. And the question kind of becomes, why are there sometimes more easy pricing plans than there are companies? Because to my mind, they should line up. And this is that circumstance again. Ambetter is a company, Blue Cross Blue Shield. You can see exact same metrics. You'll see the plan. So here we are with our standard Ambetter 700, 300. What's changing, right, is the premium and the network. But other than that, the deets are all the same, baby. But Ambetter does one thing that can confuse us. Still easy pricing, yes. Still the exact same metrics, but it's a little more expensive because of this vision and dental. So when you see that, you go into the filter and you see, okay, there's 10 easy pricing plans and you're concerned about why are there 10 when this is usually why. It's either the add-on of vision and dental. It's still the same when it comes to the healthcare part, but they've added a vision dental benefit that usually is separate for health insurance, which they can do. Never ever should someone pick a health insurance plan because it has vision and dental. They can always buy vision and dental outside the marketplace year round. It really functions a lot more like a discount plan than insurance per se. Like there's no max, there's not the same guarantees. So if this person wanted this plan, the Ambetter, and is like, dental and vision like an add-on for like my checkup, etc. Great. Let's do it. I'd pay a little more from that. Yes, absolutely. Right? Go up. That makes sense for that client. But never should a client who wants, I don't know, this plan, who wants the Oscar network or the Oscar, whatever the specific benefit is of this plan, it would not make sense for them to opt for the Ambetter plus vision and dental just because of the vision dental, right? Those are needs that can be dealt with separately and cheaply. You don't have to get vision and dental through your health insurance. And it's usually a good idea to separate those things. All right. So the final piece I wanted to go through right quickly, I feel like medication lookup is the hardest thing or one of the hardest things. We're going to pretend that Beatrice has learned that she has high blood pressure. She's been told by her doctor these are the medications she's going to need, and she wants to know what each would cost. I used to love when clients would come to us with this kind of thing because none of it is in any way intuitive. It's really hard. In fact, it's hard for me to do. Like it takes time, it's obnoxious. So I just want to reiterate, easy place to get to the summary of benefits and the formulary is the screen that says view plan details. You can get to it other ways, but when you're looking at them in a row, this is usually the best way. In doing that, you can see I have the summary of benefit in the upper right hand corner. Often the summary of benefits will actually link to the formulary, what's also called the list of covered drugs. Like if you go and take a look at medications within the summary of benefits, it'll link you to it, but you can also usually get it in that C plans thing. Formularies vary. Sometimes they're online and much easier, but I'm pulling up an old school one that's just literally a massive PDF. And the reason I do that is because I always forget to do this, and I'm like paging through a million page document like a crazy person, and I should not do that. I also apologize for saying crazy. That's ableist. I should not do that either. But what you want to remember is Control F, which sounds silly because we all know Control F. But for a formulary, this is perhaps the most important thing you can do when you're looking for a PDF. So just kind of to demonstrate, I'm in this formulary of Ambetters, and I'm looking for a medication. Hopefully you guys can see that I'm looking at that first medication, Preventivil, to see where it shows up. And it doesn't, is the short answer. Like you see that here. No results found. Very scary to my mind. I don't like that at all. I don't like that a medication would just not show up. But then I calm myself and I remember this is often the case. Medications kind of go out of date, they go out of style. And if a client absolutely needs something that's out of date, out of style, whatever, there is a way for them to get it through doctor intervention. But it will likely not show up in any formulary after a certain amount of time has passed. So be aware of that. There are workarounds for it. But often, this is why a doctor would give a client a bunch of different medications because doctors don't always know what the medication is that a client can get most affordably. So we can see here the Nebuvolol. I rehearsed how to say that, and I'm not even going to try. It's listed as a tier 3, right? So now we have to kind of pivot back to the summary of benefits to see what the cost is. So it's going to tell us that the cost for the specific medication is 50. That's not nothing, right? That might be pretty significant for her. So we want to look up this next option. What is lisinopril at? And lisinopril, we're very happy to see is 1, but it's 1B. So what's the deal? How do we know about this? And this has become fairly common to see the lowest tier split into 2, and it'll depend on the plan. But we can see probably connected to her cost sharing, her preferred generic retail, no charge, and her generic retail, no charge. So Beatrice's cost sharing is letting that be basically free either way. So if she's making this decision based on on just a financial situation, she has a good answer, right? She wants to go with the lisinopril because it'll be free. If she, for whatever reason, has had that before and prefers the whatever it is, she knows the cost of it. So it's the interrelation between these two documents. And I wanted to deep dive into that just because we do have a document that I will show y'all. Oh man, I always forget. You took the time to highlight those things and then you explain it and you don't highlight them. So these are the two documents I want to make sure people know exist that kind of go into both standardized plans and summary of benefits. The summary of benefits piece is much more about reminding people where stuff is because you forget. Like someone comes to me and says, I use a sleep apnea machine. And I'm just like, what? Durable medical equipment or what um you forget, right? You forget where stuff is. So it's sort of an overview with tips and tricks on where things are. And they're designed to look standardized as well, but they sometimes aren't exactly as standardized as we would like. So those resources exist just to ensure people are aware of how to navigate this stuff and and to feel confident in how you do it and how other people do it. So hopefully those are all useful. Oh my god, I only have 5 minutes left. Post appointment, I think the most important thing I wanted to say here, and of course these tips you guys can peruse at your leisure, but I really like to emphasize when an appointment ends what the client is responsible for, because I really don't like when clients come back and they're like, "But you made my account." I'm like, "I did, but like I can't have that. I'm not supposed to have any of that information." So, in particular, right, login information and making sure they can make their first payment and that they understand that's on them. The insurance company may send them an invoice, but they may not. And I think giving them a way to do that is so important, like giving them a phone number or if they're tech savvy, the website, right, to make that first binder payment. Sometimes you can do it immediately with them, but sometimes you really can't. And sometimes it's honestly a good idea to let the one system talk to the other before they make a payment, not to do it right yet for a lot of reasons. But just give them something, give them a phone number, if nothing else, so they can navigate themselves and they understand that's on them. You got to do it by the state, right? Okay, I rushed through the end there a little bit. I'm sorry, I am a long talker. I never get in within questions.
Thank you, Ariana. We are very close to time, but I think we can squeeze in just one question. In which scenarios might client contributions to the deductible and out-of-pocket maximum not carry over to a new plan with a SEP?
It's not going to carry over if they go to a different company, like period, end of discussion. It so if they are just making changes and the result of the change is they have a new deductible and out of pocket in their same plan, then it carries over, right? But if they're changing their plan, they probably want to call and ask. I would think even within the same company, there's no guarantee that any contribution to a plan will move with you to a different plan. Like as far as the insurance side is concerned, that's your plan. You change plans, it's a new situation. Think of it as mileage on a car almost. I'm sure there's a way that could work, and there are companies we've seen begrudgingly do it, but you have to make the request. It's going to be a lot of work. It's not easy. I would say same company, maybe, but probably not. And you're going to have to do a lot of work to get that to happen. That's not easy.
Thank you, Ari. As
Yeah.
we conclude today's session, I'd like to give everyone a heads up that next month we will be launching our lineup for the fall webinar series. The series will feature our popular topics along with new session formats. Stay tuned and keep an eye out for more information through the Beyond the Basics newsletter and website. Again,
And
thank you so much. Thank you so much, Ari, for presenting. Thank you,
guys,
Farah.
feel free to shoot me an email if it's something you want my attention on. And of course, general inquiries can always go to Beyond the Basics. I apologize for talking so long. I
No,
talk.
thank you. It's very helpful information, and we had great questions that we will try to get back to through email. Thank you, Farah, for answering questions and monitoring the Q&A chat. As a reminder, all materials from today will be distributed via email, and everything will be posted to the website. So thank you, everyone, and I hope you enjoy the rest of your day.